Thank you very much to the moderators and the Society for the honor of the virtual podium today. This is my third time trying to record this talk. I think I'm having some problems with my microphone, so if you're having audio issues, I apologize. Please sit tight. I promise there's some juicy content that you'll enjoy. I have nothing to disclose. I first started talking about social media on the podium about 6 years ago, and the world has changed quite a bit in the last 6 years, and I want to discuss that briefly. The most important thing that's changed since I started talking about this years ago is that the audience is much more experienced. We used to have these big symposiums at national meetings where we tell people what a tweet is and how to set up a Facebook account. And today's audience doesn't need that tutorial or a toolkit to get through these simple tasks. Most people also understand the power and volatility of social media better than they used to, because we've now all witnessed multiple celebrities, politicians, and physicians lose their credibility and career after bad online behavior. What that means is I can't shock you with examples of bad behavior or consequences anymore, so maybe I need a new shtick. So then what should I do with my 8 minutes here on the virtual podium? I mean, I can talk for hours about social media ethics. So I'm going to be intentionally abridged so that I can drive home a few important points. In discussion of the legal pitfalls in social media, the first thing I have to say is that we're not robots. We all like to eat and drink, make jokes, share funny videos, discuss politics and religion. And most of the time we can probably do it with very little consequence. And nobody's telling you what you can and cannot do, and nobody's trying to define professionalism. However, the main thing I've always told people is that there's probably unintentional overlap between your personal and your professional life in your social media profiles. And the internet is immortal. Once something is out there, it cannot be reliably extracted, so when you get in trouble, the past can come back to haunt you. Let's say you find yourself in a malpractice lawsuit. The first thing the plaintiff's attorney is going to do is scour the internet for information about you, including anything you've ever said and done online, including your social media profiles, reviews, negative and positive from rating websites, even talks from national meetings. And they're going to use this to paint you in a negative light to build their case. Additionally, if you find yourself in a news story, positive or negative, the same thing can happen, and in that case, the journalists will say they're just doing their research. It's easy to find examples of bad behavior from surgeons online, and this is something that maybe you did a few days ago or maybe did it 10 or 15 years ago, but it's still available for me to see, and I don't have to create any fake accounts and snoop around your private stuff to do it. It's all available to the general public online. The problem with these is, the behavior doesn't always look that bad. This is pretty benign appearing to me. They're at a brewery drinking some beer on Sunday Fun Day. The problem is it's Sunday Fun Day, and a lot of them probably had cases on Monday. All of these posts are date and time stamped. If you ever find yourself in a lawsuit, what the lawyer is going to say is, I see from your Twitter account you had a few drinks that night. Do you always drink alcohol the night before a big case? How'd you feel that morning? Now, this isn't fiction. This is fact that's happened on multiple occasions. People will often argue that we're human and we should be able to do what we want to do, including drink beer, shoot guns, discuss politics, etc. And nobody's telling you what you can or cannot do. But you have to remember that you're the subject to the court of public opinion. And so whatever you put out there is going to be unfairly scrutinized and viewed out of context. Judgments are going to be made. Reactions will often be disproportionate. We're not celebrities, but we are public figures, and we're representing our academic institution, our hospital, and profession. And there's a lot of responsibility there. And if you misbehave, you're not the only one that's affected. If I go online and say something stupid, the headline's not going to read Sean Langenfeld makes a sexist post on Twitter. It's going to read Nebraska medicine surgeon makes sexist post on Twitter. So there's often quite a bit of collateral damage to the institution, the residency, the professional society, and beyond. So what can we do about it? My advice, take it or leave it. First thing, read your institution's social media policy. Most people in the audience today have not read their institution's social media policy, and ignorance of this is not going to prevent you from getting in trouble or even possibly losing your job when you violate it. You should police your content. Google yourself periodically. That's not narcissism, that's self-preservation. And maybe, even though it's unreliable, take down that 15-year-old Facebook photo you do in a keg stand in med school if you don't want your patients to see it. If you want your patients to see it and you understand the risk, you can do whatever you want. Just remember that nothing is truly private and everything is discoverable. And then measure twice, post once, especially when discussing emotional topics, and remember that sarcasm doesn't always translate well on Twitter. Before we talk about ethics, I have to start by just talking about some of the things that I absolutely hate about social media. Social media reduces the world to black and white and right and wrong. People judge things on face value without background or nuance. They allow the worst member of a group to define the group. They allow the worst actions of a person to define that person, no matter how brief and uncharacteristic. We make these judgments with absolutism and permanence, and it absolutely drives me nuts. I had to pick one topic today, and I chose online surgical education and the ethics involved in that. Social media has connected surgeons from around the world, allowing us to share experiences, make connections, and more. Education has benefited greatly from this. You can stay up to date on the literature through visual abstracts and journal clubs. You can use YouTube and Facebook groups to familiarize yourself with new treatments and technology. And just like you're doing right now, you can follow national meetings from your living room. There's also the concept of e-mentorship that's emerged that I think is wonderful. Online, there are virtual surgeons lounge where you can troubleshoot tough cases, share experiences, and receive near instant expert opinions. Now, when I say expert opinion, that's a good segue for my next question, and that's how do you define the social media surgery expert? Is it the loudest person in a group? There's always a few of those, including somebody like me. Is it somebody with the highest follower count? Whoever puts up the coolest YouTube videos or the most YouTube videos? Do we really know the credentials and experience of these surgeons? Is it possible they're doing a fake it to make it approach to their online persona? And do we understand their conflicts of interest? Because one of the biggest drawbacks of social media is we really don't have to disclose our bias. Now, when it comes to technical innovations, is it okay to have a new surgical technique disseminated through social media? How many patients are in these series that we're seeing online? Is there any true follow-up to determine if the outcomes are compared to the standard of care are acceptable? And more importantly, is the casual Facebook user sophisticated enough to practice a new complex technique on patients after watching a couple YouTube videos? Now, I went through, right before this talk, I scoured SAGES and the Robotic Surgery Collaborative closed Facebook groups in my own specialty and did some calculations, and exactly 0% of patients have had a single complication or stayed more than a couple days in the hospital. So certainly what we're seeing online is reporter bias. Now, some of you may know I spend an unhealthy amount of time discussing cases in these closed Facebook groups, and I'm seeing a very dangerous trend emerge that I want to warn people about, and that is that some surgeons are beginning to value their own experience and anecdote over the literature and almost disregarding literature because it doesn't apply to what they've experienced, and that's a very dangerous way to practice medicine. So what can we do about this? How do we keep things ethical in social media? Certainly you need to insert more data and less drama into our online discussions, acknowledge and accept the bias and limitations of things we learn online, and use online communities to create new collaboratives. Bring evidence-based medicine and peer review into the 21st century, and certainly that'll make it a healthier place for us all to work together. Now, that's all I have today. I still finished under 8 minutes despite my having to record this a third time. Thank you for your patience. If you disagree with me, I'm happy to discuss this online. I love internet arguments, but I warn you in advance, I'm a little bit of a last word freak. Thank you.